cardiovascular system consists of heart, blood vessels, and blood. The function of cardiovascular system to transport nutrition and oxygen-rich blood to all body parts and deoxygenate blood back to lungs. The term cardiovascular refers to the heart, cardio, and the blood vessels, vascular. The picture on my left shows cardiovascular system in our body. There are 4 gender-specific differences in cardiovascular health. The first one is risk factor. Female have high relative risk of traditional cardiovascular disease. Second one, age-related changes. Female experience more accelerated increase in left ventricular wall thickness. The third one, anatomical and functional differences. Female have smaller heart, smaller blood vessels, and smaller blood volume. And the last one is cardiac output. Female have worse prognosis and higher death rate after an acute cardiovascular event. Hospital mortality rate up to 16% compared to 11% for male.
In males, cardiovascular risk factors tend to manifest at a younger age due to a combination of biological, behavioral, and genetic factors. Men are more likely to experience high blood pressure and dyslipidemia, which include elevated levels of LDL cholesterol and triglycerides. This factor contribute to atherosclerosis, which can lead to coronary artery disease, heart attack, and strokes. Additionally, men are more prone to engage in risky behaviors such as smoking, excessive alcohol consumption, and a sedentary lifestyle, all of which significantly increase the risk of heart disease. Smoking accelerates the development of plaque in the arteries, raising the likelihood of cardiovascular events. Men also tend to accumulate abdominal fats, which is closely linked to insulin resistance and type 2 diabetes. This increases the risk of developing heart disease and metabolic syndrome, a condition that involves a combination of high blood pressure, abdominal obesity, high blood pressure, and abdominal cholesterol levels. These factors together increase the chances of heart attack, strokes, and diabetes, leading to a higher cardiovascular risk for men at a younger age. In females, cardiovascular risk factors are influenced by hormonal, biological, and lifestyle changes. Before menopause, women have lower heart disease risk due to estrogen, which regulates cholesterol levels and supports healthy blood vessels. After menopause, the drop in estrogen increases LDL cholesterol and decreases HDL cholesterol, raising the risk of atherosclerosis, coronary artery disease, and strokes. Women also tend to gain abnormal fat after menopause, increasing the risk of insulin resistance, type 2 diabetes, and high blood pressure. Women with diabetes face a higher cardiovascular risk than men. Hypertension and gestational diabetes during pregnancy also raise heart disease risk. Moreover, psychosocial stress and atypical symptoms like fatigue, nausea, and shortness of breath are more common in women, which can delay diagnosis and treatment, leading to worse outcomes.
Now, I'll explain to you about genetic predisposition. We start off with male. For category of sex differences in cardiovascular are develop heart attack earlier than women, higher cholesterol and plaque build-up lead to more heart attack. Men have only one X chromosome, which may increase genetic risk. For sex chromosome effect, men are more likely to inherit risk factor from cardiovascular from their mother. This is such hemophilia and certain mitochondrial disorder affect males to due unique inheritance pattern of the X and Y chromosome. For female, sex differences in cardiovascular lower risk of heart disease before menopause due to estrogen, higher risk after menopause, more likely to develop heart problems related to autoimmune disease. For sex chromosome effects, women have 2 chromosomes, which may offer a protective effect if one X chromosome carries a defective genes. Women also face unique risks related to X-linked conditions like Turner syndrome, which can cause cardiovascular abnormality. Now we talk about for both gender. First, genetic factors. gene variants, certain genes increase risk for condition. Family history. A family history of heart attack disease can increase your risk. Inflammation. Some genetic variation affect inflammation, contributing to heart problem. Second are genetic testing. Genetic testing can identify risk for heart disease by checking some specific genes related to cholesterol, blood pressure, and diabetes.
Now, my name is Dinesh, and I'm here to talk about disease presentation vary according to hormonal influences. Cardiovascular disease, or also known as CVD, presentation and progression are slightly influenced by hormonal variations, particularly sex hormones, stress hormones, and metabolic regulators. Estrogen, predominant in premenopausal women, offers protective effects by improving endothelial functions, increasing the nitric oxide production, and maintaining favorable lipid profiles. As a result, women tend to develop CVDs later in life, usually post-menopause when estrogen levels decline. However, the presentation in women is often atypical with symptoms like nausea and fatigue overshadowing classic chest pains. Now, talking about sex hormones and estrogen and testosterone, estrogen has the same effects that I have previously mentioned, such as offer protective effects by improving endothelial function, increasing nitric oxide production, and maintaining favorable lipids profiles. Women are most likely to experience CVDs later in life with atypical symptoms such as fatigue and nausea, particularly after menopause when estrogen levels decline in the woman body. Testosterone, however, promotes earlier CVD onset in men. While optimal levels may support vascular health, excessive levels can lead to hypertension and unfavorable lipid changes. Now, when it comes to talking about stress hormones, such as cortisols, chronic elevation of cortisol due to prolonged stress increase risk of hypertension, central obesity, and atherosclerosis that can lead to conditions like stress-induced cardiomyopathy, which is more common in postmenopausal women.
So next, lifestyle factors and cardiovascular health. We have physical activity. For men are generally more likely to engage in vigorous physical activity, which improves cardiovascular health. However, this benefit may not fully counterbalance other risk factors like smoking or poor diet. And for female, women often face challenges in maintaining consistent physical activity due to responsibilities like caregiving. This can lead to more sedentary behavior, increasing their risk for cardiovascular diseases. Next, we have diet and obesity. For men tend to accumulate visceral fat, which is stored around internal organs and is strongly linked to cardiovascular events. Their metabolic response to dietary changes may also differ due to hormonal factors. So for women are more likely to store fat subcutaneously under the skin, which is less harmful metabolically. Hormonal differences also influence their response to dietary interventions, necessitating tailored nutritionary approaches. For the last one, smoking and alcohol use. For men historically have higher smoking rates, making it a major cardiovascular risk factor. They are also more prone to developing cardiomyopathy with excessive alcohol consumption. And for female, women who smoke may experience greater cardiovascular harm compared to men due to interactions between smoking and estrogen metabolism. Even lower doses of alcohol can increase their risk of arrhythmias. In conclusion, gender-specific differences in cardiovascular health are significant and need to be carefully considered in both prevention and treatment strategies. Women and men may experience distinct risk factors, symptoms, and outcomes related to cardiovascular disease, CVDs. For example, while men typically develop CVD at an early age, women tend to have a higher risk post-menopause due to hormonal changes. Women also often present with atypical symptoms, which can delay diagnosis and treatment. Additionally, gender disparities exist in terms of access of care, treatment options, and outcomes, with women sometimes receiving less aggressive treatment than men. Recognizing and addressing these differences is crucial for improving cardiovascular health outcomes across genders, ensuring that both men and women receive personalized, timely, and effective